Good morning to you all. Beautiful morning to all participants on this call. We thank God for another beautiful day. You are all welcome to the webinar for Lagos State Public Service Retirees. So before we start this morning, I would like to invite Mrs. Bolanle Owolabi to please unmute and give us the opening prayer. Please, Mrs. Owolabi Bolanle, kindly unmute from your hand and give us a short opening prayer. Thank you,
Good
ma.
morning, ma. Good morning, ma.
Good morning, ma.
Good morning. Can you hear me, ma?
You are welcome, ma. Yes, clearly.
Good morning. Can you hear me, ma?
Yes, I can hear you, ma. Yes, go ahead.
Father, in Jesus' name, let us
Amen.
pray. Father, in
Please, Mr. Jacob Sunday, unmute from your head and lead us in short opening prayer. Mr. Sunday, please unmute from your head and lead us in short opening prayer. Mr. Sunday Jacob, please unmute and lead us in short opening prayer. Okay.
Good morning, all. Let me just come in there and then do the opening prayer so that we can move on. Heavenly Father, we thank you this morning. We thank you for the opportunity we have to come together for this webinar. We ask that you be with us, take absolute control, have your way, and let your name be glorified. In Jesus' mighty name we have prayed.
Amen. Thank you, ma. I want to welcome you once again this morning to the webinar session. The Head of Service, Public Service Office, Mr. Akim Muri Okola, who is on official assignment, he would have joined us this morning. The Permanent Secretary, Public Service Office, Mrs. Sukomi Oyekola, who is also on official assignment. All the retired head of service and permanent secretaries, distinguished members of the House of the Hall, good morning to you all. Retired directors of the Lagos State Public Service, welcome. And all the service officers from different MDAs, I say good morning to you all. And to all that distinguished retired but not tired, retirees of Lagos State Public Service, I welcome all of you this morning webinar. Thank you for joining us. Thank you for joining us. As we all know, that our liver is one of the vital organs of our body. So therefore, we need to take proper care of our liver against one infection that can damage liver, which is not taken, viral hepatitis. What are the causes of this? How can it be managed? What are the ways out? If someone is affected by this disease? And this morning, we have a seasoned facilitator at home, in person of Erinosho, who will do justice to the topic this morning. And I believe before the end of the session, we will have two or three things to learn. So without taking much of our time, I would like to invite the Director of the Service Department, in person of Mrs. Dola, to declare the webinar open on behalf of the Head of Service. Thank you, ma'am. You have the floor now.
Thank you very much, Mrs. Adeniji. Distinguished member of Halahops, retired directors, distinguished participants on this call. I'm delighted once again to be with you and to represent the Head of Service and the Permanent Secretary Public Service Office on this call. They are both unavoidably absent. They are on a special assignment. They are both on a special assignment. Like you have heard from our host, our topic today is on viral hepatitis. Well, I am used to hepatitis A and B, but that is, I have a little information about it. But when I saw viral hepatitis, something came to my mind. Is there anything like bacterial hepatitis or parasite, parasitic hepatitis? That is the question that came to my mind. I'm sure our facilitator today will do justice to that. I know the information we are going to get on this call today will not only be useful for us to manage our health, it will also be useful to manage the health of every member of our family, our children, our grandchildren, and our dependents generally. So I'm sure we are going to all have information on hepatitis, the causes, the management, how to prevent, and all of that. So I want to once again welcome all of us to this call. I want us to relax. I want us to be attentive so that we can have all the information. So thank you for joining on this call, and God bless you.
Thank you, ma'am. Thank you, ma'am. And I would like to inform us that we are live on YouTube. The link will be sent to all the platforms shortly. Thank you. Thank you. Dr. Mazeedat Erinosho, a public health practitioner of over 10 years experience, a director in Lagos State Ministry of Health in the Directorate of Disease Control. He's currently the State Viral Hepatitis Control Program Coordinator, in addition to being the 1 million lives program for results SOMLP for Ag Manager, a World Bank assisted federal government of Nigeria initiative aimed at strengthening maternal and child health across the state of the Federation from 2017 to 2020. And in 2018, the state was adjourned the overall performing immunization, and this earned the state an award by the Vice President of the Federal Republic of Nigeria. She's also an alumni of AIG, Emil Kihede Public Leadership Program, in conjunction with Lambertini School of Government, Oxford University, a non-profit organization seeking to develop a criterion mass of public leaders who can transform the public sector in Nigeria and Africa and build the capacity of civil servants to deliver civil service. He enjoys reading and making a positive difference within our base and sphere of influence. She's happily married with children.
Sorry for that. Sorry for that break. I think we lost our host there, but she's just trying to introduce Dr. Erinosho. On that note, I would like to welcome Dr. Erinosho to start her presentation now.
Thank you, ma'am. Doctor, you have the floor now.
Okay, good morning. Good morning, retired but not tired directors. Good morning, Director Post Service Matters, in the person of Mrs. Drodola and every other person on this call. Thank you for this opportunity to actually come and share knowledge on viral hepatitis. Mrs. Drodola, in her remark, mentioned that she had had about viral hepatitis and then was wondering if there's do we have a bacterial, do we have fungal, do we have the parasitic one? They are all actually caused by a virus, just like you could recall during the COVID pandemic, where invariably it was a turmoil, but we thank God that for us in Lagos State, through the help of the Almighty, and our the incident commander, who happens to be Mr. Governor, deputy incident commander, who happens to be our Honorable Commissioner, Professor Akin Abayomi, as well as the permanent secretary, Ministry of Health, and the entire health team, we were able to, by his grace, combat the COVID pandemic. So we give God the glory, Lagos being an epicenter. By way of introduction, hepatitis basically is viral hepatitis is, like I said, is actually caused by virus, not by bacteria, not by fungal and any of those other causative organisms. And invariably what happens is that, I'm sure quite a number of us knows about HIV. If I had somebody just tell me anything you know about HIV, people will be able to say quite a number of things. And viral hepatitis, the federal government of Nigeria realized that the awareness is poor. And it is on that basis that a lot of attention is now being given to viral hepatitis. It mimics malaria. It is a silent killer. It kills faster than malaria. And invariably, it kills faster than malaria. Some people even think they actually have malaria, not knowing it's hepatitis. And the way God had done it is such that the liver, just like the anchor had said, it actually has the power to regenerate itself. God actually designed the liver that way. So by the time people with viral hepatitis that doesn't even know they are infected, a lot of people are going about on the streets, just like in HIV. HIV is not written on foreheads, and there's positive living with HIV. So it's on that basis that invariably what happens on that basis is a lot of awareness is being created. Hepatitis is killing silently, and federal government is giving enough awareness to it. So simply put, let me start. Hepatitis means inflammation of the liver. The liver is a vital organ, as we all know, that processes nutrients, filters blood, and fights infections. Everything we take actually is metabolized by the liver. We take a lot of fruits, we take a lot of food, we eat junk food, some of us. Let's recall that we are now senior citizens, so we need to be cautious of what we eat. Knowing that as you age, immunity comes down, and we need to actually maintain a healthy lifestyle. And when the liver is inflamed or damaged, its function can be affected. However, viral hepatitis is inflammation of the liver caused by certain viruses. Now, for It can be a bit into the background of viral hepatitis. It can cause acute, short-term, or chronic long-term infection. It may actually progress to scarring of the liver, liver failure, liver cancer, and death. Viral hepatitis causes more than 1 million deaths worldwide each year, and it is estimated that approximately 257 million people are living with the chronic disease, hepatitis C, across the globe. Sorry for that break in transmission. Can you hear me, please?
Yes, ma'am.
Okay. Now, it causes more than 1 million deaths worldwide each year. It is estimated that approximately 257 million people are living with chronic hepatitis C across the globe, while another 71 million people are living with the disease. So you can actually see that the disease burden is high. Viral hepatitis is here with us, is cross-causing across the globe. But because it's a silent killer, due to the fact, like I said earlier, that the liver has the power to regenerate itself. That is why by the time patients present with the disease, it actually had manifested to an advanced stage. We can see here that this is a healthy liver. Can we all see the pictorial that I've displayed? And healthy liver, you can see an healthy liver. Once the liver is actually getting inflamed, you now start having, all those signs of inflammation invariably. This is an healthy liver. There are no spots, there are no freckles on the healthy liver. But by the time this is an healthy liver, so if the liver starts getting inflamed, you now start having this. And invariably, the individual will probably might not even manifest any symptoms as at that time, because like I said, the liver has that capability to regenerate itself. And so now for the treatment, there are invariably vaccines to prevent this, because the question that comes to mind is, oh, there's hepatitis A, there's hepatitis B, there's hepatitis C. I'll bring in those there. Mrs. Jojola mentioned that I know about hepatitis A and B. There are invariably the different other variants of hepatitis. You have hepatitis A, you have hepatitis B, there's hepatitis C, there's hepatitis D, there's hepatitis E. But the one that actually causes lots of morbidity and mortality is the hepatitis B and C. Hepatitis A invariably is acquired through the fecal-oral means, meaning in polluted drinking water, where there is poor hygiene, that's invariably actually manifests. You realize that in slums, when slum communities, even in an environment that is very dirty, hepatitis A occurs more. But it actually happens that for we adults, a lot of us must have had hepatitis A growing up, when we're growing up during childhood, and the body actually clears the infection because of our immunity. Hepatitis B also, that actually is a silent killer with hepatitis C, also causes a lot of morbidity and mortality. Most individuals, adults like us growing up, has also come in contact and been infected one time or the other, especially during our early youthful days. But because of our immunity, our body is able to clear it up. So in about those that now have the hepatitis B and C, those ones invariably are the ones, if care is not taken, they actually manifest with the fulminant disease. Hepatitis A can be spread through food or drinking water. I will take each of them so that we can have insight as to what happens, how one can actually get infected. Like I said, hepatitis A can be spread through food or drinking water, carrying the virus through bits of fecal matter from an infected person. So that is why hygiene is very key here. I said it is called the fecal-oral route of transmission. For hepatitis B, this can be transmitted in so many ways. The same way is so similar to how HIV is transmitted. Person can be infected with hepatitis B, having sex with an infected partner, that is through sexual intercourse, sharing dirty needles, being in direct contact with infected blood. That is why our healthcare workers, they are one of the categories that are greatest risk of infection for hepatitis. Being in direct contact with infected blood, like I said, getting needle stick injuries, being transferred from, it can be transferred from a pregnant person, a pregnant woman to a fetus, meaning the way HIV, a positive HIV mother, will actually transfer to the unborn child in utero. And that is why for pregnant women that are HIV positive, they are also screened for hepatitis. Routinely now in all public health facilities, when pregnant women go for antenatal, before commencement of the antenatal, they are actually screened for HIV, hepatitis, and other viral infections. And once this is detected, that woman is actually taken up by the specialist and the management actually commences from there. Being in contact with an infected person. For hepatitis C, remember I mentioned that hepatitis B and C are the one that causes the major morbidity and mortality. Those two are the major silent killer in individuals. That also can be gotten the way hepatitis B is gotten, sharing dirty needles, direct contact, getting needle stick injuries. For sexual intercourse, it is less common than having sexual intercourse with somebody that is hepatitis B infected. Blood products are currently tested for hepatitis B and C, so it is not likely that a person will get hepatitis from receiving them. That is why for us in Lagos State, all blood that are being used in our facilities are actually subjected to dose screening for HIV, for hepatitis B and C, because it is one of the risk of transmission of getting infection in that manner. There's the ABC of viral hepatitis. This gives a summary of how it is actually contacted, as I said earlier, how it is spread, contaminated food and water for hepatitis A. For hepatitis B, it can be gotten body fluids, mother-to-child transmission, intravenous drug abusers, blood transfusion, and also organ transplants. For hepatitis C also is similar to hepatitis B. Now, if we look at how it can actually cause liver damage, you can see that this liver is not like the healthy liver we saw. And if it's not well treated for hepatitis B, it migrates to those individuals if they don't actually treat themselves. If they are infected for hepatitis B and C, they can actually migrate to having liver cancer and liver cirrhosis. Liver cirrhosis means the liver will be shrunken. The stages of hepatitis starts from a healthy liver. If a person is infected with hepatitis B or C, depending on the variant, it results into inflammation. The liver gets inflamed with hepatitis. Thereafter, it migrates to cirrhosis. Thereafter, it now goes to liver cancer. That is why I said hepatitis is a silent killer. By the time that individual presents at the facility, they had actually manifest to an advanced stage, which is the liver cancer or the liver cirrhosis. And this third column is actually showing that it can be prevented for one not to actually get infected by hepatitis B. Means of prevention is getting vaccination, which I'll talk about later. For hepatitis C, there is no vaccine for hepatitis C, but for hepatitis B, vaccine is available. And currently in the states, Lagos State, we just commenced the screening and vaccination of healthcare workers. We know everybody is at risk, but we are actually prioritizing because we are taking the vaccination in phases. I will actually talk about that as I go on in my slides presentation. Now, the high-risk group, like I said, the healthcare workers and the laboratory personnel. Recall that I mentioned that healthcare workers basically are at a high risk, as well as the laboratory personnel, those that are handling blood and blood products, body fluids, and all other laboratory samples. High-risk sexual behavior, the homosexuals, the prostitutes, the intravenous drug abusers. You have the men sex men now, they are also at risk. We call them the key population of men having sex with men. Then the homosexuals as well, women having sex with their female counterparts, they are also at risk. The HIV drug abusers, you have now that in different communities, people just inject themselves without no just cause. They are also at risk of getting infected with hepatitis B and C. Immunocompromised individuals, these are individuals basically that have low immunity. For example, maybe patients that have renal failure, HIV patients, their immunity is low. You have instances where individual can have HIV and hepatitis C, hepatitis B and C, that is a co-infection. Or you could have an individual having HIV with tuberculosis and also hepatitis. So you could have co-infections with HIV in some individuals. Those also are a high-risk group. Infants of hepatitis B carrier mothers. A pregnant woman that doesn't know her status. In my experience, I've had instances when I was in the clinical setting where you have women is actually at delivery. By the time we screen them, when they come in on board, the head is already on perineum, baby is about coming out. And by the time we say, okay, let's just take the sample and screen for HIV and the other variants of hepatitis, we realize that, oh, this mother is hepatitis B positive. And such a baby, it puts the baby at risk because such a baby needs to have a particular injection within 24 hours of delivery. I'll talk about that later on. Recipients of solid organ transplant also are also a major risk of this. Now, the variants, like I've talked about, the 5 known variants, the most common types, hepatitis D develops. There's also hepatitis. There are majorly 5 variants, like I said, A, B, C, D, and E, which are categorized by letters A through E. I'll keep stressing this so that we can have an understanding. Oh, so it's not only hepatitis B. There are majorly 5 variants of the virus, hepatitis A through to hepatitis E. The most common are the A, B, and C. Hepatitis D develops only in people with hepatitis B. So people that have B can actually have hepatitis D. And people that have hepatitis C, for those that have hepatitis B, for hepatitis C and hepatitis D, because D will not exist alone, it exists with B. For those with hepatitis D, okay. For those with hepatitis C, it will not actually exist alone. It actually coexists with hepatitis C. So they are actually screened for all the variants for anybody that is infected with B and C. Hepatitis D spread primarily through contaminated drinking water, just like hepatitis A, and is especially dangerous to women who are pregnant. So 5 main variant types, the A, the B, the C, the E, and the E. Hepatitis A is a virus that is present in infected person's stool, typically spread through water. The vaccine is available for children between 12 and 23 months, adults at a higher risk of A infection, and people with chronic liver disease. Invariably, sorry, it's a mistake there. Children are more at a higher risk for A because from diarrheal disease and all, especially in poor sanitation and limited access to clean water. So like I said, a lot of us growing up must have had hepatitis A, but our body immunity actually clears the infection. Hepatitis A, talking to it, oral fecal-oral route of spread, it spreads easily, it is self-limiting, it is vaccine preventable, related to poor sanitation and hygiene. It has a good prognosis. It is self-limiting, so it doesn't kill the way hepatitis B and C actually kills. So it clears on its own. Once that child or the individual, even in some adults, they could actually have it. It's more commoner in younger children growing up, especially when the mother has stopped breastfeeding and the baby has started complementary feeding. That is when you see children having diarrhea because of handling of their complementary feed. Hygiene is very key. That's I would need to note for us. When children, a nursing mother, invariably, when the baby stops breastfeeding. No, when the mother introduces complementary feed from 6 months, it is essential that the mother maintains good personal hygiene, especially handling of the complementary feed, because hepatitis A, the child could actually come up with hepatitis A, even though it is self-limiting, but it is better avoided. Like I said, hepatitis B is more serious than hepatitis A. It's more likely to progress to chronic infection, resulting in liver failure, liver cancer, and death. The virus is spread through contact with an infected person's blood, semen, or other bloody fluids. That's why for those risk factors as mentioned, blood, those handling blood and blood products, healthcare workers, the laboratory personnel, sexual intercourse, semen, and other bloody fluids. Let me stress here that hepatitis B, there is no known documentation that says it can, body sweat is also body fluid. So, but there's no known evidence that have said it can actually be contacted through body sweat. There's no evidence for that. So I need to actually, it's important for us to note that. Other body fluids, but not body sweat. Now, the facts about hepatitis B, it is life-threatening, as I said. It spreads through exposure to infected body fluids. It can be life-threatening. Prevention, vaccination as soon as possible at birth. That is why the hepatitis B vaccine was introduced in 2004. So for children that were actually born at that, during that year and beyond till date, actually benefited. Quite a number of us, the senior citizens, did not benefit from hepatitis B vaccination because a lot of us were born before then, and hepatitis B vaccine had not been introduced at the time most of us were born. And what are it can actually be contacted mother-to-child transmission. I said it earlier in the previous slide. What are those symptoms? I mentioned earlier that it could actually mimic malaria. One of the key symptoms is fever, abdominal pain, vomiting. By the time that individual starts having yellowness of the eyes and is passing dark colored urine, even somebody that has severe malaria can pass dark colored urine. So I mentioned earlier that it can actually mimic malaria. So it is a telltale sign, and awareness we're creating awareness to ensure that people in the populace are aware about hepatitis, because the awareness is so poor, even among healthcare workers. And invariably, there's a need for us to ensure that other objects handled by infected persons. So it is essential that this is, just like HIV, can HIV be contacted through kissing, hugging? No, the same thing applies for hepatitis. It doesn't mean you have an individual, maybe a relation that has hepatitis, you want to stigmatize them. So please and please, we say no to stigmatization, just like what is done for HIV. The same thing is being advocated for hepatitis B infection, because a lot of people are walking about, even in the populace, that they don't even know they have the disease. So it is when we screen and they are tested that their status actually comes into play. It can be passed from infected mother to our unborn baby. It's most commonly spread through having sex without a condom or by injection drug use. To prevent it, vaccine is recommended at all newborns. Good a thing that has been incorporated in the National Program of Immunization for children. So children born today are privileged because they get their vaccine. They get their hepatitis B vaccine routinely from birth, 6, 10, and 14 weeks. So invariably, for those of us that were born before 2004, it is recommended that we need to know our status first, know our hepatitis B and C status, because those two are the one that causes major morbidity and mortality. And for people who are traveling to other countries where hepatitis B is more common, it is common in Africa, it is common in Asia. So globally, it is caught crossing all over the world. So it is essential we know our status, so that once we know our status and we know our status, we invariably ensure that we get vaccinated. Let me reiterate, hepatitis B has vaccine. There's no vaccine for hepatitis C. And invariably, but treatments are available for both B and C, for those that are positive for both. You can have individual that can have the two. The thing with hepatitis B is, just like HIV, treatment is lifelong. But for hepatitis C, it is more deadlier than B, but its own treatment spans through about 3 months. So you see that it's actually advisable for one to know his or her status for both B and C. Now, Hepatitis, common ways the hepatitis C virus are spread is the same way hepatitis B is spread. It can be transmitted mother to child. There's no vaccine for hepatitis C, but treatment options are available that can cure most chronic hepatitis C infection and stop the progression to chronic liver disease. Because if these two variants of the virus are not treated in that individual could actually manifest with end-stage liver failure. And as at that time, nothing could be done to actually salvage that individual, which results in eventual death. Hepatitis C. Getting tested is the only way to know if you have C. It can be cured by taking medicine, but testing is the first step. So I will enjoin us. So please get to know our status. If you're walking into any of the government facilities and go to the lab and tell them you want to get tested, you want to know your status for hepatitis B. The mandate we got from Mr. Governor is actually to prioritize our vaccination. Eventually, it will get to the whole populace. But for individuals that can, we take our health as priority, especially with senior citizens. Our health should be our number one priority now. We don't need to wait on government. Government can't do it alone. As individuals, you can walk into any of the government hospital and tell them you want to get screened. Is at a cost, because currently, the only one that is free now is the routine one that is available for children. So we just commenced the screening for healthcare workers and vaccination. That's the mandate we have. By the time we get additional mandate from Mr. Governor, we're going to scale up to the other populace. So we're doing a phased vaccination. At least let's prioritize those who are the greatest risks first. But I will actually enjoin us to get to know our status. And during the public service week, we actually commenced, we had to actually do that during the public service week. July 1st to be precise, because the vaccine that is even meant for healthcare workers, the PS had to give a mandate that give the public servants an opportunity to do that. So during public service week at the DMA, we were there integrating hepatitis screening and vaccination with other disease entity. There was hypertension screening, diabetes screening, hepatitis B and C screening, and other healthcare interventions. And we're able to screen close to 1,000 public servants. We even had some retirees that came and they were opportune to actually get screened and get tested. They knew their status and we were able to vaccinate them. And that's at that time. Even at council, for those of us that went to council, we were also there to actually screen. There was cervical cancer screening, there was hepatitis screening. And we gave a first dose and we enjoined them that they should try and ensure that they complete their dose, because it's a 3-dose regimen that is being given. So the symptoms again: low-grade fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, light-colored stools, joint pain, and jaundice. Jaundice is yellowness of the eyes. So by the time that individual starts showing those symptoms of yellowness of the eyes and is passing dark urine, and the individual feels, I think it's still malaria, please and please, let's enjoin that person to please go for a checkup. Even if it's, even if it's malaria, the individual needs to go for a checkup. Please and please, it is so important. It mimics malaria, like I said, is a silent killer, because the liver has that ability. That's the way God has designed it, to regenerate itself. So even if 80% of the liver is gone, that individual might not manifest. That is how bad viral hepatitis is. It kills faster than HIV. It is 100 times more contagious than HIV. This is also showing pictorials of the symptoms variably. Like I said, visit the hospital. Your doctor will take history of symptoms and do proper physical exam. Blood tests will be done to determine the form of hepatitis and caused by the virus. There are no treatments to cure hepatitis A. It is also vaccine, aside from carefully monitoring the liver function. For hepatitis B, it can be treated successfully if detected early. But to actually prevent it, vaccination is the way forward. Hepatitis B, like I said, it's treatable, it is lifelong, but to prevent one from having it, try and get tested, know your status. If you are screened and you are negative, that is when you can be vaccinated. There's a vaccine for hepatitis B. Hepatitis B C is curable. It is deadlier than hepatitis B, but there are no vaccines. So you can see that it is essential that one actually gets tested for these two variants because they are the ones that cause the major morbidity and mortality. You might have to take this medication for some time. For hepatitis C, for example, the treatment regimen spans through 3 months, after which that individual is checked again if the person is free from the virus. So it is deadlier than hepatitis B, but it is curable. Hepatitis B is like HIV, which treatment is till eternity. It is lifelong. So for one to actually protect his or herself, screening is advocated. You know your status. If you are negative, then you are actually vaccinated. And the vaccination is a 3-dose regimen. At start dose when you screen for the virus. At preventing hepatitis A. Vaccine, like I said, hepatitis A has to do with is contacted through the fecal-oral means, poor hygiene and all that. It also has its own vaccine. I said a lot of us must have been infected growing up, but our body's immunity just cleared the infection. So we didn't know we had hepatitis. A lot of children growing up must have had hepatitis A. They just think, it's gastro. Please and please, is because of the immunity of that child. That is why we promote and encourage breastfeeding in the first 6 months of life without adding anything. If you have a mother tell you, are you doing exclusive? They tell you yes, and you ask them, do you give water to this baby? And the mother tells us yes. Please and please, that mother is not doing exclusive. It's just doing predominant feeding. Exclusive breastfeeding is giving only breast milk without any other thing apart from breast milk for the first 6 months of life. So the essence of this is because breast milk has a lot of nutrients for the development of that growing child up to 6 months. Beyond 6 months, the breast milk is not able to meet the nutritional demand of that growing child. That is when complementary feeds come in. That is when we growing up, our mother introduced all the staple food that we eat, the amala and ewedu and the like that we take. So for hepatitis A, for children that have it, vaccine is also given. Fruits and vegetables, even we adults as senior citizens, let's ensure that we are what we eat. We maintain a healthy lifestyle. Hand washing is very key, very, very essential. When COVID came, a lot of us, during Ebola, we imbibed the culture of hand washing. Ebola left, COVID pandemic came, so hand washing again came on the scene. But hand washing should be actually a routine practice. We mingle with different individuals day to day. It is essential that even when you get home, the first thing you should do is to wash your hand. Please and please is very key. I do that as a routine, and our children, they are advocates of change. And when after I had this work, as women, with the women in the house, you want to at least put food on the table. So the first thing you do is on getting home, I have to get to the kitchen and cook. Please and please. Once you drop that in your handbag, just go and wash your hand. Let's make it a routine, and it becomes part of us. It's very essential. It's a good culture to imbibe. And children are advocates of change. I've had my children tell me, Mommy, you haven't washed your hand. So it became part of me. And I tell myself, even as a medical practitioner, getting home, I want to get to the kitchen and at least do some cooking. But the culture of hand washing became a norm in my house. And it's something we need to actually imbibe it as senior citizens. It's very, very essential. And it actually starts with you and I. Cutting our nails short, clean drinking water, clean dishes, ensure that hand washing is a routine for us. Once you imbibe that culture of hand washing, you realize that it actually becomes a norm right in your household, translating to the community and the society as a whole. Don't use an infected. What are the means of prevention? Don't use infected person's personal items. Personal items, when you talk about the cups and because we are trying to prevent stigmatization, invariably, this is not actually cast on stone. You take precautions when getting any tattoos. For those of us that do tattoos on our body, do we know what is being used for that tattoos? Those of us we go to the salon. It is essential for we women that you actually have your own salon kits. Everything they need to use to make your hair, you know, make sure you go with your own kits to the salon. For the men, please and please have your own clipper. It's very essential because yes, you get to the barbing salon and they tell you they'll just clean with spirit. Make sure you have your own personalized clipper. And even for your children too, it's very, very essential. If we imbibe all this preventive culture, it becomes a norm, it becomes a good culture of practice for us, and we get better at it. We are able to actually prevent some of these disease entity. Ensuring you are traveling, ensure you don't even have to wait to travel outside the country. Ensure you get yourself screened for hepatitis B and C. You know your status. If you are negative, you are eligible to get the vaccine. If it comes out positive, you'll be referred by that doctor to see the specialist. And currently now in Lagos State, we have about 4 general hospitals where we have the specialists, i.e. General Hospital Lagos. We have General Hospital Lagos. We have Lasut is one of the referring centers where you have a gastroenterologist. We also have General Hospital Ifapojai. You have a gastroenterologist in Ifapojai as well. General Hospital is Solo. So those are the 4 public health facilities where you have a gastroenterologist. And for anybody that is tested positive, please encourage that individual. The doctor will even refer, depending on the locality that individual stays, will refer that individual to those 4 sites. I'll repeat: General Hospital Lagos, General Hospital Ifapojai, Isolo General Hospital, Lasut in Ikeja. Those are the 4 sites. Loot also, for those that say, I would rather prefer or Naima, yes. So those are the 2 federal hospitals where you have the gastroenterologist. Please help us inform our community people that, because we are a change agent in our various community, the fact that you have worked with government, you have this individual that is manifesting these symptoms, encourage them in the community to go and get tested in any of the government hospitals. And once positive, those are the 4 facilities that a specialist, a gastroenterologist is the one that will handle them. For those ones that are positive, they cannot be given the vaccine. It's the specialists that take up their treatment. For the negative ones are the ones that are eligible to get the vaccine. So please, we are all advocates to ensure that we create heightened awareness on viral hepatitis. It's a silent killer. It kills people by the day. I've had instances when we started this exercise for healthcare workers. Even amongst healthcare workers, they didn't even know some of them didn't even know they are positive. And it was an eye-opener for us because they have frontliners and believe that, I think I'm careful enough. You never can tell. All the risk factors that I mentioned, everybody is at risk for viral hepatitis. And we must ensure that, 1, we get to know our status. When we know our status, then it will determine if we're eligible to get vaccinated or not. In preventing it, let's lead a healthy lifestyle. The use of vaccination, that is the major form of prevention. Healthy lifestyle, we eat well, we don't eat junk foods, because everything we eat or take in is being metabolized by the liver. So we need to ensure that we actually maintain a healthy lifestyle. We maintain a healthy lifestyle and ensure that we get tested. If we are negative, we are vaccinated against hepatitis B. If it is positive, we're referred to those facilities where you have those specialists. Follow the rules of personal hygiene. Observe the rules of anti-epidemic regime. During the advent of COVID, all of us, we were forced to be wearing face masks. So you realize that the face mask is not only limited for the healthcare workers. This had to be done during the COVID pandemic because the viruses actually stay more in the air. So it puts everybody at risk. It is not written on faces. You don't know who is who. So do not do piercing and tattoos. We have children at home. We should actually discourage them from the use of this piercing and, using of these tattoos on the body. It is not encouraged. It doesn't even give a sense of responsibility. So as senior citizens, we are change agents, we are advocates in our various spheres. So in our various spheres of influence, let's ensure that we do this. So actually do that. For Prevention again, for people infected with the C, WHO recommends that education and counseling on options of care, immunization with hepatitis A and B vaccines for those that have hepatitis B, immunization with hepatitis A, and for those that have hepatitis C, immunization with hepatitis A and B vaccines to prevent co-infection, early and appropriate medical management, including antiviral therapy and regular monitoring for early diagnosis. So, in still talking about the vaccine again, there are vaccines for A and B. Like I said, A, invariably, it's a lot of us have been infected growing up. It mimics like gastroenteritis. The child is having diarrhea. For all we care, it might be an hepatitis A. But thank God for our body immunity, which was able to clear the infection. So in 2004, the hepatitis B virus was now introduced into the routine immunization schedule of children. So that's why for children born from 2004 till date, they are actually privileged to be vaccinated against that virus, the hepatitis B majorly. There's no vaccine yet for hepatitis C, but like I said, it is more deadlier than B and it is curable. And for those that have the C, they must ensure that they get the hepatitis B vaccine. Since you can only get hepatitis D if you have B, getting the B should protect you against getting the D. You recall that I mentioned that the hepatitis D cannot exist alone. It exists with hepatitis B. So that is why for individuals that are hepatitis B positive, they will be screened for hepatitis D. The specialists, there's something they do that we call hepatitis paneling, where for individuals that are hepatitis B or C positive, they are actually screened for these other variants of virus because they do coexist with each other. There's no FDA-approved vaccine against E, but vaccine against hepatitis E exists overseas. Example, in China, they have it in China, but in our own setting, globally now it is hepatitis B and C that a lot of attention is being given to. And reason is because the highest morbidity and mortality, and it is a silent killer. It is vaccine preventable, that is hepatitis B. And we must ensure that we all get screened and tested. We know our status and ensure that we're able to actually prevent this silent killer disease. I want to thank us all for listening. Thank you for the opportunity. I would want to just share a video on a lighter note for we, the senior citizens, before we go into the question and answer segment. So just give me a few minutes to share a video with us. So it's a video, I saw this video that was shared. So it's dedicated to we all senior citizens in the world. Thank you. I love this video. love it.
Hello, Dr. Erinosho. Thank you, ma'am. Can you say something?
Hello?
Hello. The video that is being shown now, can you
Hello,
say?
can you hear me?
I can hear you. I want to
Okay.
talk about the video.
Okay.
Okay.
Should I stop sharing?
No. Go ahead. You can say something about it as it's being shown.
Okay. All
Okay,
right.
ma'am.
As you can see,
Okay, we can't hear anything. It's just being shown.
you can't hear anything.
Yes, from the video.
Oh, what happened? You can't hear anything from the video.
Yes.
Oh my goodness. And we can just hold on, please.
Okay.
Hello, can you hear me now?
I can hear you, ma'am.
Okay. I actually thought everybody was, listening to that music, but don't worry, I will share the video. I will actually share it with the organizers so that at least always actually dedicated to all senior citizens and basically talking about leading a healthy lifestyle. There's a lot we can do. We can bike, we can hike and share. I mean, we can actually hike with our wives. Okay, we can hike with our wives. I mean, it has all the lyrics in it, so it's something all the senior citizens, can actually sing to our husbands and our wives. It's a good one, and I see in the chat box that there's been quite a number of questions. So let me just hands off now for question and answer and ask the anchor to please take over this call. Thank you, over now. Thank you for your attention, and thank you for the opportunity.
Thank you so much for this educative and informative section. So enlightening. Thank you. In the course of the program, our 20th retired head of service joined us, Mrs. Adesoye Folashade. You are welcome, ma'am. Good morning, ma'am. Also, we have Mrs. Florence Oguntuashe, retired permanent secretary and once-time commissioner in the state. You are welcome, ma'am. We also have in our midst this morning former president of the Hala House, Alhaji Olagbaye. You are welcome. Also, we have Dr. Mrs. Oduwole, retired permanent secretary in our midst. You are welcome, ma. So, on this note, we've been receiving different questions on the platform. Please, if you have questions, kindly raise up your hand. I will ask you to unmute, then you ask your question. But before then, I would like to invite Dr. Mrs. Oduwole to please unmute and say one or two things to us on this call. Thank you, doctor. You can go ahead, ma. You have the floor.
Thank you very much, distinguished ladies and gentlemen. I will stand on the existing protocol. Actually, I have learned a lot from this, and I have to thank Dr. Erinosho very
Thank you,
much
ma'am.
because a lot of things have evolved over the years.
Yeah.
Like she rightly said, the children that are coming in now are very, very lucky. Be that as it may, I would suggest that we should please all go ahead and know our status. This I didn't really know before, that we could still go check our status and then get immunized if we are negative, if we are for the hepatitis B. If we are not, we get treated. For hepatitis C, we know our status as well. If we have it, it is treatable. But at the end of it all, prevention is better than cure. So like she said, we should have lifestyle changes. One thing I want to add to it is that we should please all minimize our alcohol intake. I happen to have worked before in Pakistan, and I found out that hepatitis B, they write it on the patient's bedside. This patient is hepatitis B positive. They let you know. But here that we don't have that, let us assume that every health worker will take the precautions, and even the non-health workers. So I want to thank Dr. Erinosho again. It's a very, very good time we have had with you, I would say. It was inspiring, it was impactful, and it was very, very enlightening. Thank you. And I thank the head of service and the organizers of this. Keep it up, please. Thank you, and God bless every one of us. Amen. Thank you.
Amen. Thank you, ma. Thank you. Let me go quickly to the recap of the section of this morning. Our facilitator talked about the 5 types of hepatitis, that is A, B, C, D, and E. Also, the causes, what can lead to the infection of liver, and the stages from liver failure to cancer, then to death. Then she also talked about how it can be contacted, how one can get infected. She also enlightened us about the high-risk groups, the group of people that need to be watchful so that they will not be affected. Also, she talked about the symptoms of this disease: fever, nausea, joint pain, jaundice, vomiting, light-colored stool, and so many other things. And she encouraged us to be a guide and to be a help, to give a help hand for those in our community that have all these symptoms, that we should try as much as possible to encourage them to go for check. And also she talked about the prevention of all of these 5 phases of hepatitis. And she encouraged us to know our status. Even some, especially those of us that are in service, that we should try as much as possible to know our status, that if anybody is being affected, that fellow can be treated immediately. And she encouraged her senior citizens too to know their status. And we should try as much as possible to show love to people that are affected. We should not stigmatize them like HIV. We should try as much as possible to encourage them to see medical practitioner. And she also mentioned 4 general hospitals where we can be tested. She mentioned General Hospital at Lagos, Isolo General Hospital, also lawsuit at Ikeja and Ifakojai General Hospital. For as many of us that are yet to know our status, please let's try as much as possible to go and check so that we will know the next step to take. And she also said one thing, that as we are aging, our immunization is going down gradually. So we should try as much as possible to bear that in mind. We should reduce a lot of junk food, not for the elderly ones, especially for our children. We should try as much as possible to discourage them from taking much junk food. And Dr. Oduwole said there should be reduction in alcohol taking. For as many that are taking alcohol, we should try as much as possible to reduce alcohol taking. So thank you so much for being on this call this morning. So right now, I would like to invite people that raise up their hands to ask their question. Mrs. Remi Kuteyi, please kindly unmute from your hand and ask your question.
Good morning, everybody. I hope you can hear me.
Yes, ma'am.
All right. Thank you for this timely program. I happen to, well, after retirement, I happen to be in the food sector. And I find out that a lot of the things we consume here are like groundnuts, on the road. You just, the mama selling groundnuts. Even those in bottles, you actually don't know how they're prepared. And when the person peels the skin off the groundnuts, he uses the mouth to blow off the chaff, the skin. And you cannot really say whether the saliva gets on the groundnut and so on. For people in food that are not screened, you don't know their health status, you don't know what they're passing around. Yeah. I love groundnuts, I love it. And I find out that I usually get, all these allergic cough and whatever. Then when my husband just talked about this groundnut thing, and I stopped taking groundnut on the road, I found out that, the cough, the incidence of cough reduced. So how do we actually ensure that food vendors, are screened so as to make the population healthier? That's my question.
Thank you, ma'am.
Okay.
Okay, doctor, please.
Okay. Thank you, Mrs. Kuteyi, for that comment and question. Based on the experience you said you had, the issue of groundnuts, we take little things that we take with a wave of the hand. The experience that you said you had, that you mentioned, it's quite a good one. I just want to add on to that. How about instances where, based on what I saw too, I was at a motor park traveling out of Lagos, and I realized the young girl selling orange was actually the same knife that she used to peel the orange for you. The body was itching her. So she actually used the same knife to scratch that part of the body that was itching. And she continued peeling the orange. I was just watching at the park. I was, waiting for the vehicle to fill up. And I was traveling that day. I can't forget. And saying it was one of those things that discourages me from actually buying peeled oranges. So I discourage, colleagues, people around me, my community members that see. And whenever I narrate our experience to them, they're like, doctor, thank you for this. A lot of those things that we take with a wave of the hand is very key for us to actually maintain a healthy lifestyle. Yes, I agree with you. It is very important. For food handlers, basically in Lagos State, there is the Occupational Health and Safety Department, where in the Ministry of Health, where they do go to the hotels, the eateries, the restaurants to actually ensure that, C1, they assess the hygiene of those vendors, the hygiene of the place, they actually have to present a certificate for those food handlers. They actually screen for all these disease entities, for typhoid, for hepatitis, for HIV. And this is something they do periodically to ensure, and submissions are actually done at the local government level, where they submit the list of these food handlers to the medical officer of health, because they know they have to submit data of the food handlers that have undergone screening, and they do the submission to the medical officer of health. This check is actually put in place by government to checkmate excesses of our food handlers. Yes, you can, even in our eateries, can you actually guarantee what they do? You will marvel at what the cooking environments of what some of them do. So don't let us be deceived by the paparazzi, the ambience that you see at times in some of our eateries and restaurants. That is why those measures are actually put in place. Then another thing, on when we go to stores to actually, when we buy products in supermarkets and all, we read, let's try as much as possible to read the nutritional facts on those products that we buy. And the question I'd actually put through to NAFDAC is, are they actually sure that, how does NAFDAC themselves ensure that those nutritional facts are actually true to power? And we have been at a session where we had a NAFDAC representative and said, for every product that you see, and you see the NAFDAC registered number, it means it has undergone rigorous process. They had actually certified that that product is edible and safe for human consumption. But the one that you see on the brand, that you see that it is indicated L, that they haven't put the NAFDAC number, they just indicated an L, it means it has actually been listed for screening. So we should ensure that, you know, all this little information, they go a long way. We shouldn't be deceived by when we see some of these brands, they could actually be deceptive. So there's nothing as good as homemade food, the one you prepare yourself, that, you know, you ensure that you maintain good personal hygiene. It is very key. That I will encourage us to do. And even when we imbibe the culture of taking lots of fruits and vegetables, and we ensure that we wash these fruits and vegetables, is actually very, very important. That is as far as ensuring that the food handlers are actually put in check. Yes, we have the occupational health and safety in the state that goes to monitor, and even some of the feedback that they tell us, that don't be deceived by all the ambience that you see in some hotels. I mean, government has to put this in place to ensure that whatever is actually giving out to the public for consumption there is safe. And the Consumer Protection Agency also, there's the Lagos State Consumer Protection Agency, in which if you have any concerns about any products you bought, and you can actually get to their office and report to them, and they will take it up. So all these are measures that are put in place by government to ensure that to actually safeguard the lives of the people in the states. I see here, then another addition. Thank you, Dr. Mrs. Oduwole, for that alcohol. I wonder why I actually forgot that in my slide. It's actually very, very important. Then I see in one of the chat box here that about training. I have a retired Mrs. Otukoya Juliana is asking, she's a retired chief from Ikeja local government, and she's asking training opportunities. Yes, like I said, federal government is trying to revitalize viral hepatitis care in Nigeria, and they're coming up with a lot of measures to ensure that things are done properly. Currently now, there are actually plans later in the year to do trainings. We are going to be master's trainer as the viral hepatitis coordinator, as well as even some of the gastroenterologists in these are 4 sites. So because a lot of information keeps coming, there are new changes. So the federal government wants to ensure that, I mean, they get it right before we can even do a training of trainers, then we will now cascade down. And the healthcare workers, we're going to step down by the time they've trained us. We are going to step down for some of the selected healthcare workers. We are not even going to do it for the specialists, because it is the medical officer that is interfacing more with the patient that we're going to do selection from. The pharmacists, the community health extension workers, our advocates at the community level. So basic information they need to know with the health educators we are going to work on that. So this thing is going to take time. We are actually working towards it in phases, but we need to get the final version of the manual. We have to be trained, because it is after we have been trained that we will now cascade it down at our own level, the state and the local government level. Before the introduction, Mrs. Kumbi Adebowale is asking here, before the introduction of the vaccine in 2004, what has been the preventive measures in place that made mothers having hepatitis B not transferring it to their children? Because I've seen an aged woman that had it and none of the children had it. What scientific explanation can we deduce from such? Before the advent of the vaccine, like you said, I want to presume, mind my words, I said presume, that it is actually possible that that mother, the baby had immunoglobulin. And let me shed some light on this. For the hepatitis positive mother, pregnant positive mother, the woman, once the baby is born within 24 hours, that baby has to be given immunoglobulin to actually prevent the baby from having it. It's just like Logam. I'm sure some of us have heard about women that are O negative. Yes, I'm sure we've heard about women that are O negative. And what it means is that woman within 72 hours must have the Logam. The essence is actually for one, to protect that child from actually having a severe form of jaundice. Actually, what happens in that instance is once the woman has Logam, that first child is protected, and so that her body invariably will not be able to produce a lot of those antigen that is going to make her to stimulate a lot of that Logam, a lot of the O negative antigen, such that that baby, the next baby that she's going to deliver will not be affected. Is the same vein that hepatitis B immunoglobulin is given to the hepatitis B positive pregnant woman. That immunoglobulin is given to the baby once delivered within 24 hours. So I'm presuming in this scenario, it is possible that the woman had Logam. Even when I was in the hospital setting, I've had instances where some of the health attendants that delivered their baby, they were hepatitis B positive. It was after delivery that it was detected. I think it was about 72 hours, and effort had to be made to ensure that that baby was given that immunoglobulin. So immunoglobulin must be given to the baby for the hepatitis B positive mother to actually prevent that baby from having it. I think that's as far as what I can see in the chat box. Then when the anchor was just giving a recap, I just wanted to clear some air. Those 4 facilities I mentioned are facilities where you have the specialists, meaning for the hepatitis B positive or C positive individual. Those are our 4 Lagos State public facilities, i.e. General Hospital Isolo, General Hospital Lagos, Lasut in Ikeja, General Hospital Ifakojayi, are where you have the gastroenterologists. That's at the state level. So it means even in your PHC, you can go to a nearest PHC close to you, go to the laboratory there and tell them you want to get tested for hepatitis. It's at a cost because it is not free. It's at a cost, then you can actually ask them. Once you are negative, you know your status. You can get to the pharmacist in the same PHC and ask them that. How do they ensure that facilitate you getting your vaccine? The vaccine, I think a vial now is about 1,005 because it's now expensive. 1,005, 2,000 naira for a vial. And it's a 3-dose regimen. The first dose you are given when you are screened and you're negative. Your second dose comes in 4 weeks after, and your third dose is 6 months after you got your first dose. So it doesn't make sense to get my first dose at screening and I forget about my second and third dose because it will not confer that almost 100% immunity for you not to be prevented from having the viral hepatitis infection. So once we start, please let's ensure that we actually complete the regimen, basically to have the near 100% immunity that it will confer. And usually for hepatitis B vaccine, the booster dose for it is after 10 years, but it doesn't mean once you've completed, you need maybe within 2 months or 6 months after you must have completed your schedule, you should go and check your antibody titer. Reason is because if your antibody titer tells you that, the lab scientists will tell you, oh, your result, and will be able to tell you if you need a booster or not. So once it's greater than 10 international units for your antibody titer, you don't need a booster even after 10 years. That's the beauty about hepatitis B. Unlike some vaccines that if you are not getting it that time, let me recall the schedule for us again. If you're screened at your first visit and you're found to be negative, please ensure you get your start dose there and then. So if you have to make an arrangement with the pharmacist in the same facility, so at least they will facilitate you getting your dose, but it comes at a cost. Currently, like I said, we're only doing for healthcare workers because we know they are at the greatest risk of infection. With time, I'm sure we're going to scale up as we get more support from government. So I really want to appreciate Mr. Governor for this. It's only Lagos State that have started this exercise in all the 36 states that is screening the healthcare workers free at no cost, because we know they are our priority. If the health system is down, the healthcare workers, what will happen to the health system if they are not well taken care of? So we are prioritizing that phase. If we're able to, once we complete this, we are actually asking for additional funding from government so that we can scale up to the additional healthcare workers we have then before it now gets to the populace. But for those of us that can afford, I think I will strongly advise us to get screened. Once you know your status, you are negative, please and please get your first dose there and then. And if you get your first dose, 4 weeks after, you get your second, 6 months after, you get your third dose. Ensure we complete that dose. Please, it's very essential. Viral hepatitis is a silent killer. It kills by the day, and government is now trying to create that heightened awareness. So I really want to appreciate Mr. Governor. The fact that we are the first state that is commencing this exercise is a plus for the Lagos State government, and they really appreciate the Lagos State government for that. I'm sure Mr. Governor will have loved us to do for the whole healthcare workforce, but you know, there are other conflicting, different MDAs, everything is coming from the same purse. So Mr. Governor had to prioritize and say, okay, let's take it in phases. Start with the health workers that are mostly at risk, then we'll scale it up to the others before it eventually gets to. And that was why I mentioned that in the public service week, we even had to use some of the vaccines for the healthcare workers because the PS actually mandated that we should integrate it. It doesn't make sense during public service week that we screen you and we don't vaccinate you. It's a disservice to you. And we're able to screen about almost 1,000 public servants that day. I presume we had some retirees too there at Adeyemi Bero, July 1st. And quite a number of them are coming in for their second and third dose. So for those that were there, that had their first dose at Adeyemi Bero that day, that are listening, they should please and please come for your second and third dose. The vaccine is available in staff clinic now, and some of them have been coming. So I want to really appreciate Mr. Governor and as well as the entire cabinet for this post, and also the head of service for this opportunity that is, I presume this is a routine webinar that has been done for retirees. I really want to appreciate that. It's actually a good culture to imbibe. Thank you so much. Thank you. Over and out.
Thank you, Dr. Mrs. Really appreciate you, ma. So on this note, I would like to invite Mr. Oladiran Ajitomobi to please appreciate the facilitator on behalf of the Lagos State Public Service retiree. Please, you have the floor, sir. Can you hear me, sir?
Speaking already.
Thank you, sir.
Yes, I was saying it has been a very beautiful day, a very great one indeed. We thank our facilitator, Dr. Mazeedat Erinosho. Thank you very much for this detailed, informative, and enlightening session on viral hepatitis. It has been presented in a very, very simple way that can be followed by everybody. Once again, on behalf of our very senior citizens and all of those of us who are younger senior citizens, if you like, I say a very big thank you. A note of appreciation is very, very deep. And we thank you very much for sharing part of your time, for sharing the wealth of your experience and knowledge with us. Let me also, on behalf of senior citizens, continue to thank the Office of the Head of Service, the Post Service Department, for keeping this on. Indeed, information is power, and this office, led by Mrs. Drodola, has been doing this for quite some time. It has been gainful, it has been very enriching, it's been very enlightening. Thank you very much, and till next time, we say may God keep and spare all of us. Thank you very much indeed.
Amen. Thank you, sir. Thank you. So on this note, I would like to invite the Director of Post Service Department, Mrs. Drodola, to please declare the webinar closed on behalf of the Head of Service. Thank you, ma'am.
So let me start by appreciating Mr. Governor and his deputy for ensuring that we continue with this webinar for retirees. And I'm also very elated because our serving officers are also on this call with us. And we are learning so much on how to take care of our health so that we can have a healthy workforce and healthy families. And then we can be at peace to effectively do our jobs. A very special thank you also goes to the doctor, Dr. Erinosho, who has made everything so simple. It's a very simplified and an enlightening session. We all followed very well. I don't want to go through all that has been said over and over again, but I know we have all learned so much. Although our retirees on the call may not be able to have the vaccine now because maybe they are older than that age that can take the vaccine, but let us encourage our children, our grandchildren who are still within that range, and then let us get tested. I saw on the chat that one of the retirees mentioned the fact that a case should be made for the retirees so that they can have the test done for free. I don't know if Dr. Erinosho can do that for us. We'll be very glad if she can get it done for us. We've been advised on how to, prevent this disease. Let's be careful how we buy food from food vendors outside, because some of them are the major reasons why this disease keeps spreading. So once again, I want to thank everyone on this call. Our retired head of service, the 28th specifically, Mrs. Olashade Adesoyi, for joining this call. And I also see that Mrs. Ogutuashe, a retired PS and a one-time honorable commissioner in the state, is on this call. It's been a while that we had her voice. I hope she's still on. I want her to say one or two things to us. Please host, please unmute Mrs. Ogutuashe. We want to hear from her.
Okay.
I think she's that Florence iPhone. Please unmute her and let her say one or two things to us. She doesn't have to put on a video. We just want to hear your voice. We want to see how you are doing.
Okay. Okay. Please, you can unmute, ma'am.
Good morning, everybody.
Good morning, ma'am.
Yes,
Good to hear your voice, ma'am.
I'm enjoying every bit of it. I'm enjoying it. And I'm learning a lot, as Dr. Oduwole said. So well done. Well done, all of you. Thank you to our facilitator. That was quite detailed. So I want to also join to ask for concessions so that we can get a vaccine at no cost. Thank you very much.
God bless you, ma. I just wanted to hear your voice. You know, it's been a while. You're always speaking to us on this call, but somehow I saw that you were just quiet. Each time you come on board, you're just there and you don't say anything. So thank you for speaking to us. We are glad that you are doing fine. God bless you, ma. So I want to say a big thank you to all our participants of this call, especially those who are outside the country. I know some of us have to keep vigil to be on this call. Thank you for making it. Each time we call on you, each time we invite you, that is a lot of encouragement from our side. We are grateful. I want to say thank you to all our serving officers as well. I appreciate you all. Keep joining. You have a lot of things to learn, you know. On that note, I want to say God bless you all. And I want to encourage us, ensure that you get vaccinated if you are still within that age range. Make sure you go in for your test and make sure you watch what to take, especially when you are buying from outside. Thank you all for joining this call. God bless you all. On that note, I declare this webinar closed on behalf of the Head of Service of Lagos State, Mr. Akeem Muriokunla. Thank you.
Thank you so much, ma'am. Thank you. So I want us all to unmute ourselves now so that we can greet ourselves. Greet ourselves. It's been a while before we end the webinar.
Thank you, Mrs. Drodola, our fantastic head of service department.
Hello, ma. Hello, ma. Thank you very much, ma.
Thank you. You are so fantastic.
Good to have you on this call. Thank you for
Yes.
returning all the time. We appreciate you.
Yes, thank you very much.
Let me remind us, live on YouTube, you can still go back there for reference.
Okay.
We are going to upload also all our previous webinars.
Wow.
I've already shared the link with us, the YouTube link.
Wow.
I've shared it on Retirees platform. Please, let's keep circulating. Let's keep encouraging one another to be part of this. Thank you very much.
Yes, so good shall be our portion in Jesus' name.
Amen. Thank you, Mrs. Drodola.
Thank you. I personally appreciate
guys on this call. Mr. Jibade, I greet you. Mrs. Kutei. Esheo, thank you for joining all the time.
Yes.
Mrs. Stella Alishe, thank you for joining. Mrs. Fumi Okewo, thanks for joining. God bless you. Oh, Mrs. Shola.
Amen. Thank you very much. I'm grateful.
Thank you. Our Tutor General Permanent Secretary, retired. Thank you very much for joining this call. My Oga is here too. Mr. Ajibade Esheo, thank you for joining us.
Thank you.
And
we love you.
Mrs. D, I push out.
Yes, sir. Thank you, sir. Thank you for always coming back. And Chairman Commission, I recognize you, ma. Mrs. Oluwatoyin Adeguji Onikoyi. Thank you for joining. Mrs. Odeneye, we are glad to have you on this call.
Belinda.
Mr. Ajetumobi Esheo, Mr. Oluwanimi, God bless you.
Ajay, how are you?
Thank you. We are Oliver Twins. We are Oliver Twins. Thank
you, Mrs. Drodola.
Thank you.
President of
Mrs. Ogumola.
Public Service Retirees Cooperative Society. Mr. Sunday Owolabi, thank you so much for joining us today. God bless you.
Thank you. Thank you.
Mr. Ajibade Mokinyo, Ekushel. Mrs. Ogunmola ni o ló ń kí yín o.
And I also want to take this opportunity to thank all the
Thank you.
service team on this call. Thank you all for joining. Thank you for working behind the scene.
You're welcome.
We have a smooth webinar. God bless you all.
Amen. You are keeping us alert. The brain is being kept alert. We are moving every. Thank you. God bless you, ma. Bye.
Oh, Mrs. Sotun
Bye.
Elin Adetong. That is the Vice President, Lagos State Public Secretaries Cooperative Society. Thank you for joining this call. God bless you. But you did not unmute. Oh. Hey, keep me. Unmute and greet me. I want to see your face or hear your voice.
It is well with you, ma'am. Thank you.
Thank you, Department family. Thank you for joining us.
Missing.
Okay. At this point, I would like to thank you, sir. Thank you, sir.
Network. I hope you have seen my face, taking my face away.
On this point, I would like to end the webinar for today, but I want to remind us that by God's grace, the next 2 weeks we'll be talking about investment and business, and it's going to be another good time. Please let's bear it in mind. So on this note, I would like to end today's webinar session. Thank you all and God bless. See you next 2 weeks by God's grace. Have a wonderful day. Bye-bye.